Hello, everyone. Welcome to LUMP webinars. Let's now start with blood. There are two prominent veins, one on each side of the frenulum. When you roll up the tongue tip to the palate, the two sublingual veins should be barely visible. The observer can gain information about blood stasis from the color, size, degree of distension of the sublingual veins. These signs tell very little about location of the stasis. Western medicine sees distended sublingual veins as a sign of stasis in the venous return of blood, as in right heart insufficiency. Chinese medicine often judges these veins as sign of blood stasis in the upper burner. The intensity of color and degree of distension of the sublingual veins plus other tongue signs will provide a picture of degree of blood stasis in the entire body. Severity of blood stasis is reflected in the intensity of color and degree of swelling of the veins. Occasionally, the veins will take on a thick, swollen appearance. If it is also dark blue in color, the blood stasis is severe. Bluish tongue body, which is also a sign of blood stasis, does not always appear when the sublingual veins are distended. Even in life-threatening diseases like metastatic carcinomas, accompanied by chronic blood stasis, the tongue body color may be unchanged, with no blue discoloration. In these cases, sublingual veins are frequently distended. Distended sublingual veins plus the normal tongue body color is an early indication of qi and blood disorder, so you don't have to wait for the tongue to turn purple. Many women with uterine fibroids or positive pap smears, they have tongues with normal body color shape, but when you look at their sublingual veins, they are severely distended. Veins are visible when the penetrating vessel is afflicted with long-standing blood stasis resulting from sexual abuse or multiple abortions. So for women who have had who are victims of sexual abuse or who have had multiple abortions can have an issue on their penetrating vessel, and this would manifest as very visible sublingual veins. Sublingual veins, thin and light in color, that means the blood stasis is not very serious. This diagnostic evidence should be taken into account when you examine patients who have menstrual disorders, habitual miscarriages, or infertility. Injuries like bone fractures or torsion to sinews, tendons, muscles, they interrupt blood circulation. So this will have localized stagnation of blood in the channels, muscles, and joints. And in injuries, the blood stasis is superficial, found unilaterally. So injuries may present as unilateral distended sublingual vein. Sidedness of injury and of distended sublingual vein may not coincide. Accumulation of phlegm or damp heat in the body can be observed in sublingual veins. So there will, this is reddish blue plus a sheen. Other signs, we have blue, black, or dark spots. So this will indicate heart blood stasis that manifests as coronary heart disease or illnesses of the liver, as in chronic hepatitis, cirrhosis of the liver, or liver cancer. Thank you very much for listening. Let's now proceed to tongue diagnosis, and let's welcome straight from Rizal, Teresita Sumile. We will talk about scarlet red tongues. Good afternoon, Teresita.
Good afternoon po, Dr. Hector and classmates. Welcome to tongue diagnosis, and now let us talk about scarlet red tongues. This tongue body color is deep red with a slight pink hue. If tongue is dry or without a coating, it indicates kidney Yin deficiency with vigorous internal heat. Occasionally, only some areas of the tongue will present with this shade. most commonly anterior third of the tongue. This discoloration corresponds to severe lung yin and stomach yin deficiency. Scarlet red tongues with coating are characteristic of warm febrile diseases. Now let's go to our patient, female, 22 years old. Tongue description, scarlet red, dry, rough coating, and has notch at the tip. Symptoms, dry, red, itchy skin, fits of anger, and depression. Western diagnosis, atopic eczema. Background to disease, lack of sleep, irregular lifestyle, and alcohol abuse. TCM diagnosis are hits in the blood, slight kidney deficiency, fluid deficiency, and slight heart blood deficiency. Next is a female, 41 years old. Tongue description are scarlet red, slightly shiny, raw reddish area in the center, swollen tongue sides, especially in the central part. Symptoms are exhaustion, inability to sleep through the night or restless sleep, thirst, depression, and heartburn. Western diagnosis, none. Background to disease, pregnancy at a late age, breastfeeding for too long. DCM diagnosis are kidney deficiency with hits from deficiency, stomach yin deficiency, and underlying spleen chi and yin deficiency. Next is a female, 33 years old. Tongue description, scarlet red, raised reddish dots distributed over the entire tongue body, and long vertical crack. Symptoms, inner restlessness, tremor of the hands, and poor memory. Western diagnosis, none. Background to disease, drug abuse, like heroin, cocaine, and ecstasy. Lack of sleep, overwork, works with toxic substances. DCM diagnosis, we have kidney deficiency, hits in the blood, constitutional weakness of the heart, and hits in the heart. Thank you so much for listening.
Thank you very much, Ma'am Teresita. Next, we have diagnosis by interrogation, and let's call on Ma'am Vina Pascua of Baguio. Good afternoon, Ma'am Vina.
Good afternoon po, Doctor. Good afternoon po sa lahat. So, sexual symptoms po, day 4, lack of libido. At pag sinabi nating libido, ito yung walang gana sa sex. In Chinese medicine, libido depends on the state of the fire of the gate of life. Ito yung Meng Men, which represents the fire within the kidneys and is also called the minister fire. Pag may deficiency ng fire, it may cause lack of libido in both men and women. And also infertility. Whereas pag sobra naman ng fire, it may cause excessive sexual desire. Ito yung mga mahilig. Lack of libido in men excuse me, is usually related to a deficiency of qi or yang, most frequently of the kidneys. However po, other organs may be relevant, and a severe qi deficiency of such organs as spleen, heart, or lungs also may cause lack of libido. Sabi po ng author's experience daw po niya, a deficiency of the heart is a more common cause of lack of libido than yung deficiency ng kidneys. Among all conditions, liver qi stagnation may also cause lack of libido. Then, itong kidney yang deficiency. So, ang manifestations ay lack of libido, lower back ache, coldness, feeling cold, bright white po ang complexion, mahina mga tuhod, nakakaramdam ng tiredness, lassitude, abundant clear urination, at urination at night. Pale and wet po yung dila, at deep weak po yung pulso. Then, next po ay heart yang deficiency. Lack of libido, premature ejaculation, palpitations, shortness of breath on exertion, spontaneous sweating, slight feeling of discomfort, or stuffiness sa heart region. At ang dila po ay pale and wet. At pulso ay deep weak. Next po tayo, heart blood deficiency. Lack of libido, palpitation, dizziness, insomnia, dream disturbed sleep, poor memory, anxiety. Magugulatin din siya dahil pale complexion. At ang lips ay pale. Ang dila naman ay pale and thin, choppy or fine pulse kasi nga blood deficiency. Then next naman po ay heart and spleen blood deficiency. Lack of libido, palpitations, dizziness, insomnia, dream disturbed sleep, poor memory, anxiety, propensity to be startled, dahil pale po ang complexion, pale lips, at saka poor appetite. Loose stools, tiredness, at ang dila ay pale and thin, choppy or fine pulse naman. So, next po ay liver chi stagnation, lack of libido, hypochondrial or epigastric distension, irritability, moodiness, feeling of lump in the throat, at wiry pulse. Sa clinical note naman, sabi po ng author, lack of libido in men is often caused by a heart deficiency, whereas in women, by a kidney deficiency. So, tandaan po natin yan. Thank you, doctor. Thank you sa lahat.
Thank you, Ma'am Vina. Next, we go to pulse diagnosis. We will continue discussing the other pulse qualities. First one is very rapid pulse, chi mai. This pulse is the same as rapid pulse, but even faster. The dynamics of the pulse are the same. The heat is so powerful here that yin is being injured. So the pattern of imbalance is extreme heat. So very rapid and without strength is yin deficiency heat. Very rapid and replete, excess heat. Very rapid and superficial, invasion of exogenous heat. Very rapid and deep, internal heat. Very rapid and slippery, phlegm heat or damp heat. Short pulse. Short pulse does not occupy all the positions. It will often be in the sun position that the pulse is not fully present. The pulse reflects that yang qi cannot ascend all the way up to the upper jiao. So this could be because there is something blocking it, probably food stagnation, or there is severe qi deficiency. So patterns of imbalance, qi stagnation, food stagnation, qi deficiency. Typical combinations, short and without strength, qi deficiency, short and forceful, stagnation, short, forceful, and rapid, stagnation condition that is generating heat, short and slippery, phlegm, stagnation. Long pulse. This can be felt further up the arm proximal to the Shi position. Most people have a long pulse, and therefore the long pulse is a pingmai or healthy pulse, unless there are other qualities present. If there are other qualities present, the long pulse will indicate that there is heat or rebellious liver qi. A long pulse can be defined as a pulse that extends further than an individual position itself, a pulse that is felt when rolling the individual fingertip distally and proximally along the pulse. So patterns of imbalance, heat, rebellious liver qi. Typical combinations, long and rapid, heat, long and wiry, rebellious liver qi. Large pulse. The large pulse is a pulse that is broad and replete. It is rarely used as a separate pulse image, but is usually used as an aspect of other pulse images. The expansive dynamic of heat is the mechanism behind this pulse image. Pattern of imbalance is heat. Thank you very much for your attention. Let's now proceed to differential diagnosis, and let's call on Ma'am Teresita once again for her presentation.
Good afternoon ulit, Dr. Hector and classmates. Welcome to TCM Foundations 202 na po tayo. And let us now talk about spleen chi sinking. Center chi fall or spleen chi sinking. Etiology: excessive consumption of cold and raw foods which hinder the spleen, irregular eating and eating too much, excessive mental activity, standing for long hours every day, childbirth, menopause, prolonged exposure to damp and chronic illness. Underlying or accompanying pathology: spleen chi deficiency, stomach chi deficiency, and lung chi deficiency. Signs and symptoms are poor appetite, slight abdominal distension following food, pale complexion, tiredness, weakness of the limbs, loose stools, depression, tendency to gain weight, bearing down sensation in the abdomen, prolapse of stomach, uterus, anus, or bladder, frequent and urgent urination, in infants, depressed fontanelle. Pulse is empty or weak. The tongue is pale. Treatment principle: supplement the center and boost chi, raise yang and rectify the fall. Acupuncture treatment: REN 12 supplements spleen chi, spleen 3, the yuan source point of the spleen, bladder 20 supplements spleen chi in chronic cases. Then do 20 raises chi, stomach 21 supplements stomach and rectifies prolapse of stomach. Do 9 for prolapse of anus. Then stomach 36 supplements spleen chi, spleen 6 supplements spleen chi, bladder 21 supplements stomach and spleen chi, then REN 6 supplements and raises chi. Then needle with supplementation and moxa. Thank you so much for listening.
Thank you very much, Ma'am Teresita. Next, we go to acupuncture patterns and practice. Let's listen to Ma'am Vina once again for dysuria. Good afternoon, Ma'am Vina.
Good afternoon po, Doktor. Good afternoon po sa lahat. So, acupuncture patterns practice po tayo and ang topic natin ay dysuria. Dysuria, ito po yung painful urination due to impedance of fluid in the urethra and is often characterized by frequency and urgency, yet dribbling of urine. Sometimes there is spasm in the lower abdomen, which may extend to the upper abdomen or flank. Typically, the pain of dysuria is prickling or burning in quality. According to variations in etiology and clinical characters, dysuria may be classified into 6 groups. Ito po yung heat dysuria, chi dysuria, chyle dysuria, stone dysuria, blood dysuria, and overstrain dysuria. Yan po yung 6 variations. Etiology and pathology. Dysuria results from disorder of the transformation of kidney and urinary bladder chi. The condition is located in the bladder and the kidney, but also bears a relationship to the spleen at saka yung liver. Sa initial stage, it is mainly a condition of the strength due to the accumulation of dampness and heat in the lower jaw, which impairs po yung bladder chi transformation. And if it persists, it may turn into one of deficiency or a mingling of strength and deficiency. Dampness, heat in urinary bladder. Dampness and heat attack yung urinary bladder po through several mechanisms. Contamination or inadequate hygiene of the mucus may lead to itong pathogenic evils invading sa bladder. Overindulgence in sa fats, sa matamis, or alcohol may result in the impairment of spleen and stomach functions, conducing to the rise of endogenous dampness at saka heat, which can move downward into the bladder. Strong heart fire can move into the small intestine and then flow into the bladder. All this can impair yung bladder chi transformation at saka yung daanan po ng tubig. Pag yung ihi po is scorching hot, yung parang sobra na po yung init paglalabas and its passage causes prickling pain, it is heat dysuria. If dampness heat accumulation is long-standing, medyo matagal na, the impurities in the urine may condense and forms grains of sand or stone. Bato. This is a stone dysuria naman. If strong heat injures the blood vessel and induces blood to move wildly or erratically, blood may overflow into urine. This is blood dysuria. Pag yung dampness naman and heat attack downward, madali pong ma-impair yung bladder chi transformation. This in turn impairs the bladder's ability to separate po yung clear at saka yung turbid. Milky urine may result. This is chyle dysuria. Insufficiency of spleen and kidney. Several mechanisms lead to the insufficiency of the spleen and the kidney, including yung dampness heat consuming genuine chi senescence, weakening nagpapahina by prolonged illness, excessive physical strain, and excessive sobra po yung sex indulgence. Protracted dysuria resistant to treatment may also injure the spleen and the kidney. Spleen insufficiency allows middle jiao qi to sink. Sinking of middle jiao qi leads to qi dysuria. Pag yung spleen qi ay fails to control yung blood movement, nag-overflow po yung blood into urine at saka nagli-lead to blood dysuria. Kidney insufficiency allows lower jiao qi to leak. Itong leakage na ito ay nagli-lead to continual dribbling of urine. An insufficient kidney fails to prevent nutritive substances from leaking, so that yung urine becomes creamy and turbid. This is chyle dysuria. Deficiency of kidney yin may give rise to fire, which burns and injures the blood channels at produces blood dysuria. Pag sobra naman po yung physical strain, induces dribbling of urine. It is overstrain dysuria po yan. Then, punta tayo sa stagnation of liver qi. Stagnation or trapping of liver qi by any cause may give rise to fire. Fire attacking the lower jaw impairs bladder qi transformation, which in turn leads to distension po sa lower abdomen at saka dribbling dysuria. This is the strength type of qi dysuria. So, yan lang po. Thank you, Doctor. Thank you sa lahat.
Thank you very much, Ma'am Vina. Next, we go to signs and symptoms. Let's listen again to Ma'am Teresita. Good afternoon po ulit.
Good afternoon po ulit, Dr. Hector and classmates. Signs and symptoms 94. Our topic this afternoon is all about streaming eyes. Liver blood deficiency with liver heat. Signs and symptoms are streaming eyes, itchy eyes, dizziness, blurred vision, floaters, numbness or tingling of the limbs, scanty menstruation, dull pale face with floating red color on the cheeks, thirst, irritability, headache, tongue pale but also slightly red on the sides. Pulse is choppy or fine and slightly rapid. Next is liver fire. Streaming eyes, bloodshot eyes, headaches, dizziness, tinnitus, irritability, propensity to outbursts of anger, red face, thirst, bitter taste, constipation, dark urine, red tongue with redder sides, and dry yellow coating. And the pulse is very rapid. Next is kidney and liver yin deficiency with empty heat. Streaming eyes, itchy eyes, red and dry eyes, dizziness, tinnitus, hardness of hearing, dull occipital or vertical headache, insomnia, numbness or tingling of the limbs, malar flush, lower back ache, dry throat, dry hair and skin, brittle nails, dry vagina, night sweating, dry stools, scanty menstruation or amenorrhea, 5-palm heat, a feeling of heat in the evening, then the tongue is without coating and the pulse is floating empty. Next is heart fire. Streaming eyes, red inner canthus of the eyes, painful eyes, palpitations, thirst, mouth and tongue ulcers, mental restlessness, feeling agitated, insomnia, dream disturbed sleep, feeling of heat, red face, bitter taste, red tongue with redder tip and yellow coating. The pulse is overflowing and rapid. Thank you so much for listening.
Thank you very much, Ma'am Teresita. We now go to the last topic, bleeding. Pathology, Part 3. Stasis of blood may also lead to bleeding. This is a bit strange because stasis implies congealing of blood. When blood stagnates in the vessels and the blood connecting channels, it obstructs them so that the new blood that is continuously formed cannot enter the vessels and leaks out. Bleeding from blood stasis is characterized by dark blood with clots and by pain. It may occur from the uterus, intestines, bladder, or under the skin. Blood stasis is not a cause of bleeding in itself, but it is associated with Yin deficiency or blood heat. So let's take a look at this figure, bleeding from blood stasis. So it is although it's a bit strange because when you say blood stasis, there is congealing of blood. But in this case, there is bleeding because new blood is continuously formed and it tends to leak out. So the new blood cannot enter the blood vessels in the uterus as they are obstructed by stagnant blood and it leaks out. So you have hemorrhage or bleeding. It is easy for excess conditions causing bleeding to turn into empty or deficient conditions. For example, prolonged loss of blood from blood heat may lead to blood and Yin deficiency. So this in itself will cause further bleeding. It may also happen that prolonged bleeding from blood heat will lead to Yin deficiency because blood is part of Yin. Yin deficiency will cause empty heat, and this is a further cause of bleeding, so giving rise to a complex pathologic condition. Third possibility, we have bleeding from Yin deficiency leading to blood deficiency. Because blood is part of Yin, so you will have Yin deficiency and blood empty heat. which becomes in itself a further cause of bleeding. So we have here this figure showing to us the three consequences of bleeding. Okay, so we have yin deficiency that leads to blood empty heat, and this will cause a lot of blood heat, leading to blood deficiency because of the bleeding. And the second consequence would be qi deficiency that will lead to blood deficiency and blood empty heat. And the last one, blood heat, will result in blood deficiency and consequently qi deficiency. Summary: qi deficiency. Bleeding from qi deficiency is a passive process. Blood leaks out of the vessels as qi is unable to hold it in. Bleeding from qi deficiency is characterized by fresh appearance and bright red color of the blood. And of course, we will have symptoms and signs of qi deficiency. Blood heat. Heat causes bleeding by invading the blood portion and damaging the blood connecting channels. Heat makes the blood restless and causes it to extravasate. In bleeding from heat, the blood may be bright red or dark red, and the flow is profuse. Blood empty heat. Empty heat from yin deficiency will lead to bleeding in two ways. First, the deficient yin fails to hold blood. Second, empty heat deriving from yin deficiency may invade the blood portion. So this will make the blood restless so that it pushes out of the blood vessels. Bleeding from empty heat is usually scanty. The color of the blood is fresh red or scarlet red. Bleeding from blood stasis is characterized by dark blood with clots and by pain. Thank you very much for listening. We would like to thank everyone for joining, and special thanks to all of our presenters. Thank you very much, everyone.
Thank you din po, Dr. Hector.
Thank you po.